Hi, my name is BRIANNE Coy. This is class VTHT 2439, section 31420, veterinary nursing care. I'll begin by demonstrating how to auscultate a patient's heart and lungs. And this is my dog Peanut. So to begin, we're going to listen to her heart. We're going to assess her heart rate. So I'm going to do this using a stethoscope. And I have a timer ready here. So what I'll do, I'm going to listen to her, I'm going to count the number of beats I hear in a minute. So to do this, I listen to her heart just behind the elbows here. And more so on the left side, you'll hear it louder, but you want to check on both the left and right sides of the chest. And I'll count the number of beats I hear in 15 seconds, and then I'll multiply by 4, and that'll give me my number of beats per minute. Okay, so I got 38 in a 15-second interval. 60 minutes. So it's just under 160 for Peanut. She's at the high end. For the heart rate for a dog, a normal heart rate is between 60 and 160. As you can see, she's very nervous. She's a good dog. She just gets nervous being away from home. The next thing you want to do then, you want to compare the pulse rate with the heart rate. And to do that, you're going to listen to that heart rate once again, listen to her heart beating, and then you're going to feel the pulse rate at the same time. So it's the easiest spot I think is the femoral pulse back here on the hind leg. Once you kind of feel that, you can feel it pulsating. You're alright, you're alright. There we go. Yeah, that's really good. So what you're listening for and what you're feeling for, your heart rate and that femoral pulse rate, they should have pretty equal intensities as far as when you feel that heart or you hear the heart beating, you should feel a pulse rate at the same time. Feel it pulsating on that back leg and that vein. The next thing you want to do, you want to assess the heart's rhythm. So for Peanut here, what I would do, we'll listen to it again, but when you hear or you listen to that heart beating, you should hear it beating in pretty equal intervals. One beat followed by another beat, and they should all sound pretty similar. They sound pretty consistent for Peanut. Occasionally with dogs, it's fairly common to notice a respiratory arrhythmia. And what happens there is when the dogs take a breath in, when they inspire, their heart rate increases a little bit. And it's normal. It's fairly common for dogs. Another thing you want to do, you want to assess the heart's character. So when you listen to that heart rate, you want to hear that normal lub-dub sound, as they call it. You want to hear, is it loud and strong, or is it quiet and weak? You know, you listen for other things. Do you hear like a swishing? If you hear a swishing when you're listening to the heart, that could be a sign of a heart murmur. Heart murmurs, they're graded on a scale of 1 to 6 depending on their intensity and severity. So for Peanut today, didn't note for anything abnormal there, so she checked out pretty good with her heart. But the next thing you want to do, you want to auscultate the lungs. And to do that, there's 9 quadrants that you want to listen. You should hear normal lung sounds upon like inspiration and expiration. Okay, that sounded good. So things that would be abnormal to listen for would be any like wheezing or crackling. That could be signs of fluid in the lungs or narrowed airway for them. So, yep, and if you notice anything abnormal at all, always notify the doctor. For electrocardiography, you always need to make sure that your patient's in right lateral recumbency with their legs perpendicular to their body. And then you can go ahead and attach the leads. So they each go on a specific limb. So I remember it as green and white are always right. And then you also want to place them just below the elbow and just below the stifle. And Christmas comes at the end of the year, so red and green are at the rear. And then you have to moisten each connection with some alcohol to enhance the electrical activity. Okay, and then the other thing, you just want to make sure that your patient remains still throughout the EKG reading. You want to make sure they're not panting or breathing really heavy during it. This is our EKG. So what you can see here, you see the initial P wave. And that signifies the sinoatrial node's initial atrial depolarization. And then you can see the QRS complex there in the middle. And that signifies that the Purkinje fibers have completed a nearly simultaneous left and right ventricular depolarization. And then the final one there is the T wave, and that signifies ventricular repolarization.
This is a printout of our patient Bree's ECG. And upon further review, it actually appears that she may have a ventricular premature complex. There's a variety of causes for this. Heart disease, systemic disease, or even certain anesthetics itself can cause this. So I've actually notified the doctor of this, had him take a look, and he actually advised that the owners bring Bree in a separate day while she's not being anesthetized, so we can run another ECG just to make sure there's nothing serious going on here.
So you'd want to use it on any pet who's like aggressive, unruly, feral, if we're suspected of having rabies, of course. So this is Dante here. So you want to get the loop as big as you can at first, and then you want to loop it around their head. Okay, and then try to come a little bit closer. And then once you get it on their neck, that's when you can tighten it. So you kind of pull the rope cord here to tighten it. It's okay, Dante, come here. Okay, bud. And then you would just tighten the handle here. And this way, this keeps you away from the potential rabies suspect. Now I'm going to demonstrate how to properly clean and disinfect a cage. So today, the disinfectant we'll be using is the Rescue Spray. So the first thing that you always want to do when you're cleaning a cage here, clean out any feces, any urine, any biologic material, as it can inactivate the disinfectant when you use it. So then next, I will spray the disinfectant here, and I'll spray it starting from the top. And then I spray the sides. And then I finish with the floor here itself. And then I also spray the cage door itself. But if these become very dirty, we do clean the cage doors itself. You can actually take them off to clean them. And then the next step, you want to let the cage sit for 5 minutes. So I actually set a timer here for 5 minutes. Whoops. And then once the 5 minutes is up, then you can come back and wipe out the cage here. So we'll come back in 5 minutes. Okay, the 5 minutes is up, so now I'm good to start wiping out the cage. So you want to go through that same process. You want to start with the ceiling. Clean things up there. And then you want to follow up with the sides here. Get some more towel here. The reason you want to use this pattern each time when you spray and when you clean things out, this allows any like infectious materials, diseases, anything, germs in that, it allows them to drip down to the bottom surface there. And if you're always finishing off by wiping out the floor last, then that way you clean out that infectious material. And we'll just finish off here the outside cage door. But always pay attention to what product you're using, because it's not necessarily 5 minutes you have to wait for every product. It depends on the manufacturer's label instructions. And that's it. To perform the Schirmer tear test, you want to first get your absorbent paper strips ready. And then what you have to do, you want to bend them just at that little notch there close to the rounded tip. You want to bend them down. That allows for easier application on the eye. And then we'll go ahead and open this so I can place them. And you always want to have a timer ready. Okay, so we'll start with, this is Allie here, we'll start with her right eye. It's okay, Allie. And you want to place it just under the lower eyelid here, onto the cornea. Okay, Al. Okay. And just make sure you close, hold those eyelids closed. And you want to set your timer for 1 minute. And when that 1 minute is up, you see where that dye reaches, and that's the number you're going to get for your reading on that eye. It's okay, Allie. You're doing good. It's okay, it's okay. It's okay, it's okay, it's okay. It's okay, Al. It's okay. You're good. At 9 seconds. Hang on, hang on, hang on. Shh, 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 shh. Okay. Thank you, Allie. Okay. So this one here, it just made it to 15. So I'll make a note of that. So that's her right eye. Oops. And then we're going to go through the same process for her left eye. Okay, Al, here we go. It's okay. Okay, it's alright, it's alright. Hang on now. go. It's okay, it's okay. I know, feels funny. Okay, okay. Okay. It's okay. Okay, and that number there reached 20. So for both of those are both good numbers. As long as it's 15 or higher, that's an appropriate number for a dog. Now we're going to assess intraocular pressure using a tono pen. The first thing you want to do is apply a topical anesthetic to both of the eyes. So we're using proparacaine here. Okay, with Allie, yeah. It's okay, Al. Thank you. Okay. Then next, I'm going to go ahead and I'm going to put on the sterile cover to the end of this tonal pen. Okay, so insert the tip there. Oops. And then you just kind of gently slide the edges down. You just don't want to apply it too tight, but you also don't want it too loose at the same time. Okay, that looks good. So then next you have to calibrate the pen. So we'll turn it on. So it's cal for calibrating. Should I hold it down? Okay, now I turn it up. And I wait until it says good, which it's saying now. So now we're good to go ahead with the testing. So I have Emily here helping to hold Allie. So when Emily holds her, she just wants to make sure that she doesn't apply too much pressure to the neck, because that can affect their readings here. And then what I'm going to do, I'm going to get 3 readings for each eye. And then once I'm done, I'll calculate the average of those 3 readings for each eye. And then I just want to gently tap this into the center of her cornea here. Yeah, it's okay. Okay, so our first reading, this is our left eye, we got 22. Yeah. Okay, now, I know, I'm sorry. Oops. That's 23. No, it's okay. Okay, Ellen. Yeah. 23. Okay, and now I'm going to move on to her right eye. So Emily, I think I'll actually switch you positions if you're able. I'll hold her for a minute here. Thank you. Okay, you're doing good, Allie. Okay. You can see I'm just gently pulling up on the upper eyelid and pulling down on the lower eyelid. It's okay, Al. And now I'm going to calculate the average. Okay, so after calculating things for Allie, her right eye, the IOP was 14, and for her left eye, the IOP was 23. So normal IOP for dogs and cats is between 10 and 20. So if it's over 20, that could indicate glaucoma. So that's definitely something we would notify the doctor about. To perform the fluorescein staining for your pet, you want to first get a sterile fluorescein test strip, and then you want to get some sterile ophthalmic solution. And then you're going to open your test strip here, and you're just going to place a few drops of your sterile solution onto the strip. So we're going to be applying it to Allie's left eye today. And what you want to do, you want to allow the stain to drip onto the eye. You don't actually want to touch the cornea itself, as this could cause small microabrasions. I'm going to get a little bit more solution on here. Yeah. Good girl. And then just kind of close the eyelid, just so you kind of help the solution to work its way around on the eye. Usually by about 15 to 30 seconds the entire eye is covered. You're doing so good. You're okay. Okay, that looks pretty good. Okay, so now we're going to cleanse the eye off with some sterile water here. So Emily, I'm going to have you move her up just a little bit, just that way the water doesn't get on her blanket. Thank you. Hey Al, it's okay. I know. Good girl. Okay, so what you're looking for then, any abrasions, any ulcers on the eye, they'll come up a green color, like more so a bright green color if they're older abrasions on the eye. Typically they'll show up like a fainter green. That's a little bit more here. Sorry Al, come here. It's okay. It's okay. Get a better peek here. Okay, Allie, hang on. So for Allie's eye today, it looks okay. She actually does have a healing. You can see some granulation tissue, on her eye there. So she's actually looking a lot better than what she's been in the past few weeks. Now we're going to express the anal glands on Peanut. So first you want to make sure you're wearing gloves. Have some towels ready because it will get a little messy. And then I put a little bit of lube on my fingertips here. So the glands are located at 5 and 7 o'clock. And they'll just feel like a little ball. Oops. I think that's not right there. Girl pee. Okay, there's the wrong kind of line. Get the other one now. Good girl. Okay, good girl, P. Okay, all done. So I'll just clean the rear end here, and then I'll spritz her with some Groomade spray. We're going to be performing an enema for Peanut here. She does not actually need an enema, so I'm just going to demonstrate how you would prepare an enema and how you would administer it. So I've pre-mixed up the solution here. So I did a 1-to-1 ratio, some sterile lube, and some warm water. And for a dog that's Peanut size, we use roughly 15 to 20 cc's of the solution. But of course, you always want to check with the doctor and see what their recommendations are as far as how much to give. It also depends on the type of enema you're giving and the size of your patient, of course. So I have the 35 cc syringe here. I'm going to go ahead and I'm going to draw up about 20 cc's of the fluid for the solution here. Okay, that's good. So then next what I do, I have a catheter here ready to go. It's a closed-ended catheter. I just insert the 35 cc syringe into that, and then you kind of want to prime the catheter line here. So that's good. And then next, you always want to make sure you lube that catheter. And that way it allows for easier insertion into the rectum. So for Peanut, I would insert this catheter into the rectum, and then once you feel it's reached a stopping point, then you would go ahead and slowly administer the enema. And then after you've completely administered that enema, you would remove the catheter and then just prepare for Peanut to defecate shortly after. So always be careful, and it's good that you have the animal on a wet table, just to allow for easy cleanup after the enema. Now we're going to apply some Revolution Plus to Chance. It's the monthly topical parasite preventative. So first, to break the seal, you have to push the cap inward. Okay, and then when I place it on Chance, I'm going to put it on the nape of his neck. That way, if you put it high enough up on the neck, he can't get to it and lick at it. And then you also want to make sure you part the hair well on the neck so you get it directly on the skin. And I just give it a couple squeezes till I can tell that all the medication is dispensed from the tube. All finished. Now I'm going to demonstrate how to properly clean and medicate a dog's ears. So the first thing you want to do, have all your supplies ready. So I have my ear wash, ear medication, I have a Q-tip and some cotton gauze. So first you would want to make sure that you gently pull the ear pinna just gently up so you can access the ear canal more easily. With Peanut being a toy fox terrier, she already has pretty easy access to the ear canal. So I'll shake my medication here, and then it's okay, P. Apply the eardrops, whoops, into the ear canal. It's okay, P. 2, 3, 4, 6, 7, 8. Okay, that's good. And then you want to massage that ear canal well. You can kind of hear like a little swishing sound when you're massaging that canal. And then if you need to wait an appropriate time, depending on the medication you're using, sometimes you have to wait 10 to 15 minutes before you can wipe out the wash. Do that. But for these purposes, I'll just go ahead. That'll happen sometimes. I'll just go ahead and clean out the ear here. So the purpose of that wash is to loosen up any debris that may be in that ear canal. And then you can use a Q-tip just to gently clean the folds in the ear, but you really don't want to get down deep in the ear canal onto the parts you can't see. This is more so the portions on the ear pinna that you can see. You're doing very good, Peanut. Okay, so then next, to medicate the ears, we have some Pat Odic, and this medication here, it actually has a dispenser here that's made to go down into the ear canal. So when you administer this, make sure once again you're pulling gently up and outward on the ear pinna, and that you place the medication dispenser into that ear canal and give a couple drops of the medication depending on what the doctor's instructions are. And then once again you want to massage that ear canal well. Now I'll be cleaning and medicating our clinic cat Chance's ears. I have him placed in his cat bed here. He's just more comfortable laying in his bed. But I have all my supplies ready. So I start by first applying the ear wash. And you want to make sure you hold up that ear pinna so you can get down into that ear canal. Whoops. With cats, I feel like they're more likely to shake their head than dogs. Okay, that's okay, Chance. You're alright, you're alright, you're alright. And then make sure you massage that ear canal well. So you can hear that kind of swishing, sloshing around sound to loosen up the debris. Okay. And then, yes, I know. And then I have my cotton gauze here, and I'll kind of clean out the ears. Oh boy. And I have a Q-tip here. I'll kind of get around in those folds in the ears, the hard to reach places. It's okay. I won't get too down deep in that ear though. You don't want to damage anything in the ear canal. It's okay, it's okay. You're okay. I know, you're very cooperative. A little bit. Okay, good boy, good boy. Okay, so now I'm going to medicate the ear. Once again, I'll be using the Pad Odic. So this here has that applicator tip on it that's designed to go down into that ear canal. That's perfect. And then you want to make sure, you're okay, make sure you massage that ear canal well once again. Good boy. I'll demonstrate how to administer sub-Q fluids using lactated ringer solution. So I've pre-warmed up my fluid bag just prior to filming this video. I've connected the IV line and a 16 gauge needle. So now I'm going to put it in this pressure bag here. And then I'll pump up the bag to pressurize it. So to determine the appropriate amount of fluids to give your patient, you first, it's based off of your patient's size, and then also it depends on why they're receiving the fluids. Finish this here. Okay, my black line appeared, so that's pressurized enough. So today we have Chance. He's an 11.6 pound cat, and he's receiving fluids because he's mildly dehydrated. So based off of the fluid calculations of using 0.75 mils per pound per hour for him, he would need approximately 208 milliliters of fluid per day. So we'll go ahead administer those fluids. But for this pressurized bag here, we've already pre-calculated approximately how long it takes to empty the fluid bag here. So in order to administer the 208 mils to him, I'm going to divide it between two locations. So I'll do it in the interscapular area and then in the flank as well, one of the flanks here. And then I have a timer set here for about 45 seconds. So I'll do 45 seconds in the interscapular area and then in the flank area as well. One other thing, I know Carla's going to be helping to hold him here, which will help, but you always want to have towels ready, as the injection sites tend to leak a little bit after the injection. So, that ready? Towel, you ready? So I just kind of tent the skin here by the neck, and then you insert the needle until you feel it kind of poke through the skin. Okay, Chancey. Okay, I have a timer. Open the fluid line. And we're going. Good. Okay, get ready with those towels, Carla. Okay, Thank you. Okay, and then now we're gonna do flank. I think I'll do the left flank area here. Oh, sorry, Chancey. I'm sorry. It's okay. It's okay. It's okay. There we go. We're now gonna finish the rest of Chance's sub-Q fluids. So we've put an Elizabethan collar on him to kind of distract him and make him think about other things. But once again, 45 seconds. I'm going to go into the right flank here. Have our towels ready. Find his knee. Put my little tin of skin here. Okay, Chancey. Okay, Chancey. I know. Fluids are going. Timer's going. That's a good boy. Good boy. It's okay. It's okay. It's okay. It's okay. We're actually just about to the end of our fluid here. There we go. Okay. Carla, I'll just have you hold down on that towel there. Got it? Thank you. Okay, and he is all done. Now we're going to trim Peanut's nails. So it always helps if you have an assistant hold your patient. So first things first, I have a bottle of styptic powder ready in case we cut too far back on the nails. So when you trim the nails, you want to make sure that you trim back to the quick, and that's about where you want to stop. So it works easiest on white nails, you can see through them. Peanut's okay, but Peanut's got some darker nails too. So you kind of have to guesstimate. It's okay, P. Hey, I know. Peanut's not the biggest fan of getting her nails trimmed. You're fine.
Peanut.
Hey. It's okay, it's okay, it's okay. Okay, we'll do one of her back paws too here. It's okay, it's okay. Okay. We're going to trim cat's nails now. This is Chance. So we use these smaller clippers here, and once again you trim back to the quick. Okay. Oops. Okay, that's good. Get the other paw. You're fine. Maybe Carla, I'm going to have you spin them around for me. And then once again we have the styptic powder ready just in case we get too close on the nail bed if it starts to bleed. Okay. Going to apply a wet to dry bandage to Peanut here. She has a laceration on her left front forearm here. So I'll start by applying some sterile lubricant to the wound itself. It's okay, P. And then I'm going to clip the hair around the wound. The purpose of putting the lube on that wound was so that it catches any of like the hair clippings in there. Okay. Hang on. Okay. We'll clean it off there. Okay, so that looks pretty good. So now what I'll do, I'll apply some chlorhexidine scrub around the wound here, but I won't actually get inside of the wound. That could irritate, and it's toxic inside the wound there. Pretty good. So now I'm going to lavage the wound. So how I'll do that, I have some sterile saline here. I've already pre-warmed it up. And then I've attached an IV line here. I have a 3-way stopcock, 35cc syringe, and a 19 gauge needle. So what I'll do here first, I'm going to fill up my syringe. And then we're just going to kind of flush the wound out. Oops. There we go. Okay, so that looks pretty good. Okay. So now what we're going to do next, so I'm able to apply some sterile saline bandage, or excuse me, sponges to the wound. I'm going to open a sterile stainless steel bowl. And then I have some sterile 3x3 sponges. Okay. So what I'll do next, I'm going to put on some sterile gloves here. And then Dr. Henderson's going to pour some sterile saline into the bowl for me. I have about 3 of this sterile saline soaked sponges. I'm going to apply them to that laceration there. Oops. And then I'll put about 3 dry ones on top. Okay. Hold those there. And Carla, actually, yeah, if you can just hold the edges. So what I'll do now, I'll just put a thick absorbent cotton layer over the top here. It's okay, P. And then I'll finish by putting some vet wrap on the top to kind of secure it all in place. It's okay. Oops. Oops. Okay, that looks pretty good. I'm going to apply a modified Robert Jones bandage to my cat George, and he's sedated right now. So the first thing I've done, I've applied some bandage tape to a tongue depressor, and what I'm going to do is measure about a third of the way up on his leg, and I'm going to place the tape on his leg just to help secure the bandage in place. And I'm going to do this tape to both the lateral and the medial side of his leg. Oops. So that's good. I'm going to apply the cotton padding layer to the bandage. So I start at the distal end of the foot and I'm going to work my way up proximally. I want to make sure that the toes, I leave some room where the toes will stick out a bit so we can monitor George throughout his bandage process here. Oops. And as I'm wrapping this, I want to overlap the padding layer about 50%. Oops. As I go. So that's going to be my first layer here. Okay, so I'm going to repeat that process again, starting down at the bottom of the foot here, working my way up proximally. Okay, so now I'm going to apply my elastic gauze here over top. So I'll use the same process, start at the bottom, work my way up, and overlap 50%. And this will help to compress the padding layer. Okay, so now I'm ready to place the splint here. So I'm using a commercial plastic splint here for George. We did have to cut it, so I'm going to modify it for his size. And I'll just apply some tape to it just to help hold it in place a little bit here. But I don't want to do the tape, apply the tape too tight. It's just more to help keep the splint from shifting while I'm placing it. Okay, so now I'm going to apply another layer of elastic gauze, once again starting from the bottom, working my way up. Overlapping 50% each time. Okay, and now I'm going to go ahead and take off the tongue depressors here from the tape. And this is what's going to secure the tape here to the bandage, and I just kind of twist the tape. And then now I'm going to apply that wrap to the outside. And with this part, you want to make sure you can see a portion of the cotton padding here down by the toes. Still using the overlapping technique here. Yeah, that looks pretty good there. So you just want to make sure you don't have any of the vat wrap kind of come in contact beyond the cotton padding layer, because that can cause irritation. Now we're going to remove the modified Robert Jones bandage and splint from my cat George. So what I'm going to do here, I have some bandage scissors and I'm going to cut through the vet wrap. Off. And then I'll just kind of unravel some of this gauze off here. Okay, so that's good. Okay, so now that that's off, you could either use your bandage scissors to cut through the layers or just unravel it. With it still being a pretty fresh bandage, it's pretty easy to unravel it right now. But if it had been on longer, it might be easier to use bandage scissors to remove the padding layers. Okay. And then for this tape layer here, we have some ease off spray. I'll apply to spurt. It just allows the bandage to come off easier without ripping a lot of his hair out. Oops. We're going to give Holly here her antibiotic pill. This is Carla's dog, Holly, by the way. So what you want to do, open the dog's muzzle and place the pill as far back in the mouth that you can. And then I always kind of close their mouth shut just to kind of help stimulate them to swallow on their own. But you always want to wash it down with some water here. So I have a syringe of water. Sorry, Carla. Good girl, Holly. We're all done. To administer a pill to an animal, what you want to do is open their muzzle, and then you want to place the pill as far back in the mouth that you can. And then I always close their muzzle shut. That way it helps to encourage them to swallow. But it's always good to wash the pill down with some water. Good girl, Penny. Okay, we're going to take some dental x-rays now. So I have my dosimeter badge on, and I'm going to place the sensor plate. Okay, now we're going to place the sensor plate for a dental x-ray here on the lower mandibular premolars. I'm going to use the bisecting angle technique. I'm going to get 6 feet away now. Shooting. So this is 307. Zoom in a little here. So you can see here are the roots, the crown of the tooth. You can see the pulp chamber. You can see a little bit of the jaw down here. We can see some of 308 as well. It does cut off a little bit on the roots there, but it looks like there's beginning stages of furcation here, and it looks like the roots here are resorbing a little bit, so this might be a tooth that the doctor would want to extract. I'll perform hand scaling using a universal curette. So what I'll do, I'll use the blade side of the curette to help remove any calculus, or if there's any staining on the teeth, that'll help to get that out. Okay, and then I'll also want to get subgingivally with this universal curette. So when I insert it subgingivally here, I want to make sure that I go under at about a 0 degree angle. And then once I am subgingival, then I can adjust it from anywhere from a 45 to a 90 degree angle. And this just helps to remove any calculus or debris that's subgingival. I'm going to use the ultrasonic piezo scaler to scale the teeth here. So it's important when you use this, you never want to point it at a 90 degree angle towards the tooth. You always want to have it at either a 0 or a 15 degree angle from the long axis of the tooth. And this is going to help you to remove any calculus from the teeth. And then it's also important that you have a steady stream of water when you use it to help prevent it from overheating. It's important that you only scale in a tooth for about 10 to 12 seconds. Once again, just to avoid overheating.
Can you zoom in anymore? Yeah. Zoom back and see more of Brianne. And then let's zoom in again.
Once your ultrasonic scaling and your hand scaling is completed, then you're able to polish the teeth. So this is done with the prophy angle, and you'll just go ahead and put it on your low speed polisher. The purpose of this is to smooth out the tooth surface after microscopic abrasions have been made on the teeth with scaling. So now that my angle is placed, I'm going to open a cup of prophy paste. And what I do first is I kind of coat all the teeth with the paste. Just the teeth that I've scaled are the only ones I'm going to apply the paste to so far. Okay, and then I will fill the cup again, fill that cup head up, and then when I polish these teeth, I'm only going to polish each tooth for about 1 to 2 seconds at a time, just so that way things don't overheat. And I want to make sure that cup flares out on the tooth when I apply it. You always want to make sure your cup is full of the paste. Okay, and then once that's done, you'll want to rinse the teeth with some water to rinse that paste off. Okay, looks good. Ms. Dalton, allow me to discuss with you some home dental care following Noodle's dental cleaning today. So I have the sheet here, and this is showing you that her stage of periodontal disease was a stage 1 today. And that's noting for gingivitis, early gingivitis for her. So we really caught her in an early stage, so her dental cleaning today helped set her back to a grade 0. But in order to keep her mouth healthy, it's going to be best that you practice a daily home dental care routine at home. So the best way to keep plaque from building up on her teeth would be to brush her teeth daily. I'll show you the proper way to do that. So you want to use a soft bristle brush, and when you brush, you want to make sure that you get those bristles kind of under the gums there, and just go in a back and forth motion on each tooth. But it's important when picking a toothpaste for her that you use a pet formulated toothpaste, because the human kinds can upset their stomach some. But I'll also give you this form here that shows you a variety of home dental care products that you can use at home. So up top there, that's showing like different rawhides and shoes. Those are more so for dogs, but those are rawhides and that are approved by the VOHC. They're good to keep the teeth clean. For cats, pretty popular ones, there's water enzymes or enzymatic gels. and they just work by using natural enzymes to help keep bacteria and plaque from building up on the teeth. There's also special kibbles, like this TD kibble here. They work by encasing the tooth with each bite, and they clean the tooth for you. Other things you can do, there's this carrier support powder. Just uses natural minerals when you sprinkle it on the food to help keep bacteria and plaque from building up. But for you, Noodle, just find the best combination that works for the two of you.